Thank you so much, Joe. Welcome, everyone, and thank you for joining us this afternoon. If you just take a second to look at the slide, you'll see if you have any questions, we would ask that you please submit those in the Q&A box. We will monitor that and answer your questions. And also a reminder, there will be a post-event survey at the end of this webinar, and if you could give us just a moment of your time to complete that, we would greatly appreciate it. If you want to come back and reference this webinar again, the recording and the slides will be available on the iPHD website. Okay, next slide. Thank you. I am Rachel Hammond. I'm the Chief Ethics, Data Privacy, and Research Integrity Officer for the New Jersey Department of Health, and I have the privilege of being a member of the iPHD Governing Board, as well as its chair on behalf of the Commissioner of Health. Just to very briefly review the agenda so you know what kind of fun we're going to get into today. We're going to hear from Joel Cantor relative to the iPHD accomplishments to date. Then we're going to hear from Oliver Lontok on iPHD application process overview, from Jose Nova regarding the iPHD data sets available and linkages, and from Kate Scotto regarding our fee schedule for data and funding opportunities for assistance with those fees. And then Margaret Kohler will get into the what's next. What does the future hold for the iPHD project? Following that, we'll have a Q&A session. Next slide, please. Okay, so a little bit of brief background to level set us all. The iPHD project was created by a state statute, which was enacted September 11th of 2016. The purposes of the iPHD project are articulated in that statute, which are to improve public health, safety, security, and the well-being of all New Jersey residents. Additionally, the iPHD project is charged to improve the cost efficiency of government assistance programs and to promote population health research by New Jersey institutions. The iPHD Governing Board is in but not of the New Jersey Department of Health, and we have a really spectacular website for any more resources, or if you'd like to come back and reference it or take a look, the website link is right there. Let's go to the next slide. Thank you. So if you're sitting there thinking, what does the iPHD project have for me and why should I apply to the iPHD project? Administrative data sets really are much more impactful when they're linked across data sets rather than when they remain siloed in isolation from one another. That integrated data holds the power to inform pressing population health research for our New Jersey residents. The iPHD project also provides the opportunity for pilot studies that can inform future proposal development. The governing board is charged and has authority under the statute to grant access to the data as well as fee waivers to researchers at New Jersey-based institutions with the intent of expanding access to the iPHD data. Next slide. Thank you. This is just a very brief snapshot for you all of who is on the iPHD governing board. These positions are as well set forth in our statute. And as you can see, we have a nice mix of ex officio positions as well as appointed positions from several different appointing authorities and quite a bit of expertise in all the areas that we would want for a project such as this. We also have our Deputy Attorney General listed. He's not specifically a member of the iPHD governing board, but a very integral piece to help guide us through all processes. Let's go to the next slide. Okay, so my colleague, distinguished professor and director of the Rutgers Center for State Health Policy, and also iPHD Governing Board ex officio member, Dr. Joel Cantor, will now provide you all with an update on the iPHD's key milestones, growth, and accomplishments since 2022. Joel?
Great. Thank you so much, Rachel and Joe, for setting this up this morning. And welcome, everybody. It's really nice to see a lot of new names, folks who haven't applied for our PhD data yet, who registered for today's session. So I will go over where we've been so far, and then we'll turn to the nitty-gritty about the application process and so forth. So um, the governing board establishes the research priorities of the iPhD, and this slide summarizes what those priorities are. There's more detail about each of these on the iPhD website. So the original ones that were approved in 2019 address the opioid epidemic, maternal and infant health outcomes, integration of physical behavioral health services, and addressing social determinants of health. In the following year, for obvious reasons, the board added a focus on COVID-19 and other public health emergencies. And then a little over a year ago, the board added an additional priority in the area of high value care. And as you saw on the earlier slide, this is one of the statutory purposes of the iPhD is to improve cost efficiency of governmental operations. And this research priority speaks directly to that. Next, please. So the board reviews, and you'll see we have an extensive review process. Um, uh, Only the governing board has authority to grant access to the data, and these are the things that they focus on in reviewing applications. Number one, does the project advance the statutory purpose of the iPhD and address one or more of the research priorities shown on the prior slide? Is the study team, the principal investigator and the team well prepared, well trained, and have appropriate expertise to conduct the project? Does the research methodology and strategy, is that appropriate? Is it well reasoned to accomplish the aims of the project? And last, is the scientific environment or the supports that are needed to get the work done in place? And this includes if we were to distribute a data set there for data security and other matters, those ingredients necessary to bring a project to successful conclusion. Next, please. So iPhD by the numbers. So we have integrated more than 80 million records across multiple data sets, representing approximately 20 million unique individuals. These are all New Jersey residents. And for those who are quick with math, you realize not all of them are still New Jersey residents. So these are people who lived in New Jersey at some point over the span of the data. 10 data sets are in process for inclusion, and we'll talk a little bit about that. There have been 26 projects approved, 30 some applicant institutions, and we have a lot of emphasis, and a statutory purpose of the iPhD is to help build research capacity for population health research in New Jersey, but we do take applicants, any qualified applicant, and some of our applicants and approved projects are conducted by out-of-state institutions. We curate, and thanks to Joe, we curate an active list of contacts, interested parties. If you're not on that and you'd like to be, please go to the website and sign up. We have a very active website, especially during application cycles, with over 200 monthly visitors. We have more than 70 individuals who review applications for us, the Research Advisory Council, or RAC. And we have distributed or approved fee waivers for in over $200,000 to date to help support New Jersey-based institutions to conduct iPhD research. Next, please. So enough projects have been approved and in place for some time so that the word is getting out about some of the findings. One peer-reviewed publication so far, and we know there are others in the pipeline, and also coverage in various news outlets about some of the projects uh, that are already in play for the iPhD. And all these are live links, so when you get the slides, you'll be able to click through and see these things. Next, please. This is just a sampling of some of the projects that have been approved by the governing board. There are others. And again, you can click through and see descriptions or descriptions of all of the projects on the iPhD website. These data sets, because they're longitudinal, covering a fairly wide period of time, are often really useful for applying quasi-experimental causal inference methods like the first project listed here, where comparison groups can be constructed and proper statistical techniques applied. Other really good uses involve descriptive epidemiology, and you see some of the projects on this list describe, for example, the last one, agricultural, fishing, and forestry injuries analysis using machine learning, the legacy of pesticides in maternal and infant and child health in New Jersey, in that case, linking exposure data to the iPhD data. And so on. And we'll talk a little bit more about data linkages for outside the iPhD data collection, but I encourage you to sort of dig in and look at some of the projects that have already been approved, these and others on the website. So I think now I turn to my colleague Oliver Lontock, Senior Research Manager at the Center for State Health Policy, who will take us into some of the details of applying for data.
Great, thank you, Joel. Now I'd like to walk everyone through the iPhD application process. So first, who is eligible to apply? Any qualified researcher whose project aligns with the approved purposes and research priorities of the iPhD can apply for data access. Please note that only researchers affiliated with a New Jersey-based institution are eligible to apply for a waiver of data access fees. Otherwise, data access fees apply to all approved applications. Also, students are welcome to apply, but their applications must be submitted under the supervision of a faculty member. Now, underlying all these criteria, it's important to note that the iPhD project is committed to supporting a diverse pool of applicants. Formal application forms and detailed guidance can be found on our website. Next slide, please. So how to apply for the iPhD data access? So the first thing to note is that our upcoming cycle 6, request for application opens on May 7th. You can check our website, check our events calendar, and mark your own calendar. The iPhD application process has 2 main steps. First, applicants submit a letter of intent via our email to our iPhD mailbox, which is due on May 28th. This is non-binding, but required in order to submit a full application. This letter briefly outlines your project proposal, its objectives, and how it aligns with the iPhD research priorities. Then, your full application is due on June 18th through our secure application portal available on the iPhD website. Our full application is comprised of the abstract, the narrative, the CV, the application itself, and a data request form, all things that are available on our website. Now, it's important to note that applications can only be submitted during the announced application cycle, and specific guidance documents, including detailed instructions, templates, and FAQs, are all available on the website to support you. We encourage applicants to familiarize themselves with the posted resources early to ensure their submission is complete and competitive. Next slide, please. Now, this slide illustrates that everything you need, forms, instructions, and guidance, it's easy to find on our website. We're always working to make the site more user-friendly for applicants. And again, just repeating something I said earlier, Just one thing to keep in mind is that the application materials are only available during the official application cycle. So be sure to check back regularly. Next slide, please. Now, to further assist researchers, we've launched several new resources on the iPHD website. First, there's an application process infographic, which visually walks you through each stage of the process, from letter of intent to data release. We've also posted sample materials, including examples of a strong letter of intent and a full application to help you prepare. The funding and fee schedule page is another key resource. It details current data access fees and explains eligibility for potential fee waivers. In addition, the iPHD application review process page explains the structure of the review process, timelines, and decision criteria in greater depth. All of these resources are designed to make the application process as transparent and accessible as possible. Next slide, please. Now, once your full application is submitted, the review process involves several stages. First, it undergoes a preliminary administrative review where we just determine that it is complete. Should there be a missing component, for example, a missing CV, we will reach out to you. Otherwise, we will pass the application to our next stage. It is assigned to at least 2 members of the Research Advisory Committee, affectionately referred to as the RAC. And the RAC is a panel of about 75 subject matter experts, researchers, and data specialists who conduct the initial technical review. Next, a subcommittee of the governing board, comprised of 2 board members and 2 external reviewers, synthesize the RAC feedback and develop a recommendation. And then finally, the governing board deliberates during a public session to make the final determination on whether to approve data access. Now, while the board gives strong consideration to the RAC and subcommittee recommendations, they are not bound by them. This multi-tiered review structure ensures that projects meet high scientific standards and comply with legal requirements and align with the iPHD's goals. Now, with that, I'll pass to Jose Nova, our Associate Director for Data and Analytics here at the Center for State Health Policy.
Thank you very much, Oliver. As Oliver said, my name is Jose Nova, and I will be talking a little bit more about the data sets available in the iPHD and the linkages that have been conducted. So currently, as you see, there are 5 initial data sets in the iPHD project, all coming from the New Jersey Department of Health, namely the birth data, New Jersey mortality data, hospital discharge data, the New Jersey CDRSS data, specifically COVID-19 PCR positives, and the EMS data. If you're not very familiar with those, I can give you a brief summary on some of these. So the New Jersey birth data contains attributes of the newborn and mother, the mother's prenatal history, pregnancy and birth details, as well as newborn care with procedures and interventions. And currently this data is available through the iPHD from the year 2000 up to 2021. The New Jersey mortality data that comes from the mortality death certificate data contains information about the deceased, including demographics, date and cause of death. And this data is for New Jersey residents, regardless of where the death occurred. The New Jersey Uniform Billing Hospital Discharge data includes information from inpatient discharges and in-person visits made to hospital emergency rooms and outpatient departments. Some of the data elements include admission and discharge dates, encounter information, such as diagnosis and procedure codes, patient and provider characteristics, as well as total charges and other charges. And the data for the hospital discharge is available from 2010 up to 2022. The CDRSS, more specifically the COVID-19 data from the CDRSS, which is the Communicable Disease Reporting and Surveillance System. This contains information on COVID PCR positive reports, including dates of onset, lab results. Essentially, it serves as an indicator of confirmed cases. And this data begins on the onset of the pandemic, which was in 2020, up to 2022. The iPHD also contains EMS data, which it's details on the EMS response to calls throughout New Jersey. Some of the data elements include information about the scene, such as date and times, the type of transfer that occurred, i.e. hospital or helicopter, and others. It includes relevant medical history and procedures or medications delivered by the dispatched medical response team. And data for this data set is currently available for 2017 up to 2022. So each of these data have different lag times. So by the time for them to get to us, and then we have to process them for linkages. So those are the data sets currently available in terms of the sets and the time frame, but we expect to refresh all of these with an additional more recent year of data sometime in the early summer, so look out for those. I would also highly suggest that you take a look at the iPHD data page, where you can find more information about these data sets, including comprehensive data dictionaries and also the variable list. And this is important to note because although the dictionaries are very comprehensive of all of the fields available, the variable list will guide you on what specific data elements are available for release. And I can talk a little bit about that in terms of de-identified and limited data sets that are available through the iPHD in the next couple of slides. So some of the value added that the iPHD does here is that we create a longitudinally linked data at the individual person level. So we're conducting probabilistic data linkages to the person level entity. And this is useful not only within a data set, but also to be able to track individuals across multiple different data sets that are shown here and more to come in the future. So we prepare project-specific, de-identified, and limited data sets for approved projects. And we also provide limited technical assistance when the needs arrive. Next slide. So talking a little bit more about the data processing and linkage capacity, as was mentioned before, we've reviewed about 80 million records to date, and more are coming in. And like, for example, with the birth and mortality data, those would be 1-to-1. But then when you have a hospital discharge data set, you'll have many records there, which right now accounts for the most of our data in our set. A person can have several encounters here. And so during this large period of time, you can see for the roughly 60 million or so records, we have identified about 13 or so million individuals. I do want to note that this also includes, there are some out-of-state individuals that we do see, even though it's a small percentage. It also includes records where even if we don't have the appropriate level of information to make linkages, let's say name and date of birth are all missing, we still create a study ID for that record and sort of denote it as an individual. So you will see those records there as well. Next slide. So talking a little bit more about the sort of the type of data that we're releasing. So there are two types. There's de-identified and limited data sets. De-identified data excludes the 18 specific identifiers listed on the screen. So some of those are sort of more obvious, but I do want to draw attention to number 2 and number 3. When it comes to geographic IDs, all the geographic subdivisions smaller than a state, including street address, city, county, Princeton, zip code, and their equivalent geocodes, except for 3-digit zip codes, are excluded in a de-identified data set. And for number 3, in terms of dates, all elements of dates except year for dates that are directly related to an individual, including birth date, admission date, discharge date, death date, and all ages over 89, and elements of dates, including year, such that they get aggregated when top coded at that level. And the rest are sort of more direct identifiers in terms of social security numbers, medical record IDs, biometric identifiers, and others. Next slide, please. The iPHD is also permitted to release limited data sets, which excludes most of the 18 identifiers that were previously described, but it may include one or more of the following. Specifically, dates such as admission, discharge, service, and dates of birth and dates of death are permissible. With the geography, municipality, state, and full zip codes are permitted, as well as ages in years, months, days, and hours. So the iPHD limited data sets released by the iPHD will include only the minimum necessary information needed to complete the approved research project, and the use of an LDS will be governed by a data use agreement. So as I mentioned, there are other data sets that are, we're working on introducing to our set. We've also talked a little bit about how to handle third-party linkages. So this would be for non-iPHD data. So linkages between the iPHD data and other data sets that will be evaluated for technical feasibility and HIPAA compliance to ensure that linkages do not enable re-identification of individuals. And additional fees may apply for linking external data. So more to come on that. And with that, now I will introduce my colleague, Kate Scotto, who's the Associate Director of Research Administration at the Center, and she will walk you through the fee schedule and funding opportunities.
Thank you, Jose. Hi, everyone. I'm Kate Scotto. I'm going to walk you through our fee schedule and some examples to calculate fees. So this is our current fee schedule. It is, we have to reevaluate it every few years, and the fees charged to an awardee are the fees that are current at the time of data transfer, not at the time of the award notice. So you might receive your award, but if it takes you a year to get your DUA, IRB, and everything into place, the fees will be from that time when it's complete. The current fee schedule is in place until December 2026. So for this cycle coming up, these should be the fees. And even though the data is grouped within the tiers, the fees are per data set. So the tiers are related to the complexity of the data set. I'm going to walk you through a few examples so that you can estimate your fees when you're submitting your application. Next slide, please. So this is example one. The applicant is asking for 12 years of birth data, 12 years of mortality data, 6 years of hospital data, and 6 years of EMS data. For the birth and mortality, the fees are at the maximum. And for the hospital and the EMS, the years are at that second level. So based on that, it's a pretty straightforward calculation. It's $22,800 for the total for the I think that's, an easy example. So now we'll go to a second example, which is a little more complicated. So this second example has a specialized linkage, like Jose was saying, in the third party linkage. So for this example, the applicant set up time with Jose and his data team to discuss the specific linkage that they were considering for their proposal. They discussed what they were looking to do and agreed that the linkage could technically and compliantly be done. Like once that was determined, Jose and his team estimated the number of hours to complete the job. So in this example, they estimated that the linkage to the outside publicly available data would take the team about 8 hours to complete. So the applicant requested 22 years of birth and mortality data, 2 years of hospital data, and then that additional 8 hours for the specialty linkage. All three data sets were at their maximum fee, and then the outside was that additional calculated to 4,000. So that would make the total 21,500. The key takeaway here is that this example is that any external linkages should be discussed with our data team to ensure feasibility and compliance. Next slide, please. And I also wanted to let you know that in this upcoming cycle, the Department of Health is offering two data fee waivers up to $25,000. To qualify for the fee waiver, you must be from a New Jersey institution. If you're selected for the fee waiver, no monetary transaction is required on your part. The fee is paid directly by DOH. Of course, that is if you're within the $25,000. The fee waiver selection is made by our governing board, and it's based on the excellence of the proposal. Please keep in mind that the governing board is trying to support as many researchers as possible, so they're disinclined to give the same researcher multiple fee waivers. That concludes my part. Thank you for your time. Now my colleague, Margaret Kohler, the Executive Director of the Buckhurst Center for Slate Health Policy, will walk you through what's next for iPHD.
Thanks, Kate. Good afternoon, everybody. Before I just go through the last couple of slides and do our thank yous, and we'll open it up for to address any questions and answers, I want to say two quick thank yous. One is to introduce him, who he didn't introduce himself, Joe Brecht, I think, who is the communications manager and our Zoom host. It was really integral in putting all of this together. So thank him for his effort in coordinating the webinar today. We certainly appreciate it. The other gratitude and the word of thanks goes to our colleagues at the Department of Health for their continued commitment and support for the iPHD. Kate just started to talk about the funding support that we're committed to continuing, and because of the Department of Health's commitment to the iPHD to be able to do these fee waivers, as well as really thank, and I've scrolled through the attendees, and we have a number of our colleagues from the Department of Health, including a number of data stewards, and I can't emphasize enough how much support and cooperation, I think Jose would reiterate this, that we have received from our colleagues at the Department of Health who work with these administrative data sets, the EMS data, all of, I mean, some of these data sets are just really considerable and complex, and they have been very generous with their time in not only the transfer of data, but the transfer of knowledge. And that's really been integral. And I think we'd be remiss if we didn't acknowledge that. Right now, all the data sets, as Joel had described and as Jose described, are from the Department of Health. Moving forward, we are actively working to receive data from other sources, from other agencies within New Jersey. There's a strong sustainability and growth plan to add data sets to the iPHD, and we're really excited about that. So we anticipate that we may have a new data set in the fall, and we'll certainly be communicating more about that. But more immediately, what's next for the iPHD? So as was previously mentioned, the iPHD cycles that are coming up, we'll have two for the remaining part of the year. The next release will be May 7th. There'll be a letter of intent due, non-binding, but required. Really, that's just a way for us to try and think about lining up reviewers and to be able to anticipate what the volume of applications will be. Governing board decision in October, and the data transfer at in early 2026. In cycle 7, that would be initiated in the fall, starting in September, and then going through the process to culminate in mid to late 2026 for the data transfer, which kind of seems far away, but time is moving very quickly. One of the things that I would say, and we did a little bit of analysis on the registrants, so we know that a lot of people are new and have not applied there, and hopefully you'll be enticed after hearing what the opportunities are for the iPHD. And for those of you who have already applied and want to learn more and maybe apply again, I think one of the things that I said, we have been working really hard over the last few months to try and increase the speed with which we can push out data sets, really looking at our processes, which are really rigorous, and we're sort of proud of the way it works. But we want to make sure that we're looking at time to turn around with to move the data sets out the door. We're not going to do it at the expense of the rigor or the compliance, but we are trying to assess, because we understand, very, very clearly that there are challenges, and in a to try and be as timely as we can in terms of the return of data for an applicant. So it is something that we're mindful of. This kind of work, this doesn't turn around in a matter of weeks, obviously, for all of you who are in the trenches and know the complexities of doing external reviews and write-ups and a governing board process. And we're never going to shrink it so that it's a drive-through process. But we are trying to see where we can nip and tuck and expedite in some areas so that we, while still maintaining the rigor and the balance and the integrity of the process that we think we've built so far. Next slide, please, Joe. The other, looking on the horizon, what's next? So we have the immediately, we'll have the next cycle coming up next week. We're also planning for a fall research consortium. And again, this was part of the statute to require that the iPHD, excuse me, engages with the research community to have this kind of research consortium. We had sort of a kickoff early on in 2019, and that was when we established research priorities. Then we had a virtual research consortium during COVID in 2022, and that was like, that was great. Commissioner Persicelli was generous enough through everything she was dealing with to speak virtually, but we're really going to try, we're not going to try, we are going to host it in person. So we're in the process of doing that. That'll happen in the fall. And really think about what are more effective strategies for using the iPHD for actionable research. We're going to revisit our current research priorities, look at where there are gaps or there are opportunities. Should we add a research priority? As Joel said, we had 3 to start with. Then during the pandemic, we would have been remiss if we didn't add the COVID research priority, the public health preparedness research priority, and then we added sort of high performing health services research priority. So we certainly can add a research priority. It really needs to align with the state's goals, but we certainly understand what they are, and we're very open to that and bringing that back to the governing board. We'll also at the Research Consortium, I think the value of that, and certainly if we're in person, is to have current applicants, potential applicants, future applicants to really get together and hear about the research that is ongoing. If we're going to do this in early fall, we are going to have a panel of presentations about the work that was supported through the iPHD, because that's what we're doing. That's what we're doing it for. It's to get the data out to inform research that has the potential to make change and to inform policies. So I think that would be the most interesting part of the in-person research consortium. We'll also obviously have some breakout sessions about the data and providing some, being able to answer questions and provide assistance. So look for that. We'll be probably sending a save the date in June. We're trying to figure out the best location. And I can say to a Jersey crowd that what is driving some of the decision about where to host this is where is parking least awful and most convenient for our guests. And since, Trenton, we're looking at Trenton or New Brunswick, there are challenges all the way around, but we really are committed to trying making it as accessible as possible. We have certainly learned that being in person has value, but we wanted to give people a heads up and give some time to planning for an in-person event in the fall. And frankly, that's why we've done this kind of touch base webinar now. We felt it had been a little long since we had communicated to our network, our growing network, thankfully, of iPHD supporters and interested parties. So we wanted to at least get in front of you, let you know we're still chugging away. We've had some good luck and accomplishments and a lot to be proud of, a lot of work being done, a lot of work still to be done, process improvement going on every day. So I'll stop there. My last item is that you will be receiving a link to complete a survey at the conclusion of the webinar. I really encourage you, as Rachel said, please do fill it out. It's very short, Qualtrics. And if you have any ideas for the Research Consortium, anything we've missed today that we can certainly cover in the fall, please do offer any suggestions or reach out to us independently if you have any thoughts. So again, thank you for your time, and we'll spend the last 20 minutes. If anybody has questions, we'll be happy to take it. Thank you again.
Margaret, we have a question. It's about the fee waiver. If you're not approved for the fee waiver, can we buy the data based on what we need? And there's a follow-up question that where can we see or visit to understand the procedure of purchasing the data?
Want me to take that?
Yep.
Yeah.
So if you get awarded, if the governing board approves you, you can go ahead and you don't qualify for a fee waiver, you can go ahead and purchase the data. You still have to, apply and receive approval in order for you to purchase the data. There is no direct purchase. Did that answer the question?
And the fee waivers are limited just because funding is constrained. So the two reasons why you may not receive a fee waiver is just the funding is limited, or if you're outside of New Jersey, great proposal, great team, happy to give you the data, but because this is funded by the New Jersey Department of Health, this is a New Jersey statute, the resources and the fee waivers are being kept, are being awarded to New Jersey institutions. But please apply, and we'd certainly love to consider the application.
The next question is, are there any data sources that the iPHD is considering incorporating in the future? Example, office-based visits.
So I can start that answer. The governing board has authorized inclusion of additional data sets, including office-based visit data. That's not the only step that's required. That's the first step. So we then need to go to the respective state agencies and work with them. Need to determine in some cases whether it's even permissible for them to share data. That's a bit of a time-consuming process. And then we have to onboard the data, and Jose and his team work through the linkages and so forth. Depends on the identifiers. It's a complicated process. So this is all to say the answer is absolutely yes. It is our ambition to keep adding data sets, making the iPHD data yet more valuable for population health research. And I can't give you a schedule, but I can say stay tuned and sign up for our email list, and you'll be notified when new data are coming on board.
Okay, there is a follow-up question regarding purchasing the data. So whom should I contact to apply the purchase?
Well, I'll start that one off again. So as Kate said, you're only eligible to purchase the data after the iPHD governing board has approved a project for you. So you have to apply through this year. We'll have the 2 deadlines for applications. And then after that, after approval, and then there's some paperwork to execute. We'll need documentation of IRB approval. We'll need a data use agreement signed. That's when we start talking about data purchase. So if you're interested in information about what things will cost, that's on the iPHD website, so you can estimate in advance. If you have questions about that, you can write to us at the address on the website, or I think we gave it at the beginning of the presentation as well. But there's no way to just purchase data without going through the application process. There were questions that we answered directly in the chat about what level of geography is going to be available, and Jose covered that a bit. We don't send out geocoded data or specific addresses, although in some circumstances, if you have, say, environmental exposure data, then that can be linked. We will do the linkage for you. We need to be able to assure ourselves and the board that we're not indirectly enabling identification of people in the data set. But we have done this, we are doing it. And, it's a process that at least in some circumstances has worked well.
So the next question is, this is about if we were not approved for the last cycle, can you revise and resubmit?
Yes.
So
We
we do,
encourage. Yeah.
So we do share the RAC reviews with all the applicants, so you can review those for resubmission.
Yeah, I would say, having been to all the board meetings, that it really is the desire of the board, and Rachel, correct me if you think I'm wrong, but it really is the desire of the board to get the data out there and get the data used to meet the objectives of the iPHD, to support population health work. So this isn't like a grant out process where there's only so many that can be approved. They'd be happy to approve everything. But they do apply the standards that I presented at the beginning. So I think I would encourage folks who aren't approved to review why and then to resubmit.
Thank you, Joel. Completely agree. We as the governing board want to see more applications, and we very much encourage folks to resubmit, taking into consideration the RAC review. We'd be delighted to see a revised application. Thank you.
The next question is, is there a different process to apply for a fee waiver versus the direct purchase? No, the answer is it's the same application. And I think we still have a checkbox of whether you're interested in a fee waiver, and but it's all just one application.